Jade Newton has a Bachelor in Health Sciences and is currently undertaking a PhD in the School of Nursing at Curtin University. And Jade is going to talk to us today about the out-of-pocket costs for people living with high-grade glioma and their carers. So take it away, Jade.
Yeah, we're all united under Associate Professor Georgia Halkett, who's our fantastic supervisor over here at Curtin, spearheading a lot of this work. So yeah, I am here presenting outcomes from Georgia's carer intervention trial that was conducted over the past couple of years. This study is specifically looking at the out-of-pocket costs that were reported by people living with high-grade glioma and their carers. Yeah, so we know we have limited information about the cost of high-grade glioma in Australia. We know that from a societal perspective, it costs 2.9 million per year, and that's from a study that was done by Access Economics for Cancer Council New South Wales. From a patient perspective, it costs around $2,000 per patient per year. That is a figure that was estimated for people with eye, brain, and central nervous system cancer. But we don't have any actual information on the out-of-pocket costs that have been reported by people with high-grade glioma and their caregivers. Most studies estimate costs from the medical perspective, so looking at the costs of their treatment and everything. And that's where this study comes in, aiming to describe the out-of-pocket costs that were incurred by people with high-grade glioma and their carers. This is using study from the carer intervention trial, which was a nursing support intervention for carers of people with high-grade glioma. Eligible participants were older than 18 years of age and undergoing treatment within 2 months from diagnosis. And the cost surveys were administered within 21 days from enrollment, and then every month thereafter while they were in the study. People had the option to opt out of completing those surveys whenever they wanted, and the cost surveys asked information about the patient and caregivers, medication, health service use, hospital admissions, and stuff like that, medical costs. So in the control arm, because we in this study wanted to report the costs for usual care, 90 carer patient dyads were in the control arm, of which 69 completed at least one cost survey. The average age was 57 years, and the majority were female, caring for their partner, married, born in Australia. 37% were employed full or part-time, and the majority were receiving chemoradiation from a public hospital. This is a diagram that I'll explain because there's a couple more. So this is the total medical out-of-pocket costs for patient carer dyads as reported by carers. And on the left vertical axis is the 2023 Australian dollar costs that were reported. And that relates to the blue box plots. And then on the right vertical axis is the percentage who returned a cost survey. So that is that reddy pink area in the background. And as you can see, we had 100% return a survey at T0. And then there was a kind of sharp and steady drop off in survey completion in the months following that. But for each month, the median cost reported was generally between $150 up to almost $500, but there was a massive range in costs that were reported by people each month, from $0 up until well above $1,000. And that was for the total medical costs reported by both the patient and carer. This diagram just shows the contribution of each cost category to total costs reported each month. And the key takeaway here is that the main contributors to the patient and carers costs were patient medications, health service use, and travel, which leads into this next set of diagrams. Just breaking that down a little more to show you the patient and carers monthly health service, travel, and medication costs. And as you can see, once again, obviously, patients reported a greater proportion of patients reported costs for health service, travel, and medication. And there was massive range in the costs that they reported. So even though the median is generally under $100 for most of these cost categories, the range that was reported was massive. We did want to try and get an understanding of predictors of higher costs, but due to low survey completion, we were only able to compare costs at T0. Those surveys were returned 2 to 3 months after their diagnosis, and we didn't find any significant predictors in the bivariate analyses, looking at demographic characteristics. And yeah, this study had a couple of limitations. Obviously, recall bias. We were asking people to recall costs in the 4 months prior to when they, not 4 months, 4 weeks prior to when they returned the survey. So they may have forgotten some costs by then, and we did have the low completion rate after T0, which is completely understandable because it was a big survey. So it was awesome to get the data we did. The key takeaways from this study were that a high-grade glioma diagnosis has a massive and sustained impact on people diagnosed and their carers. And as we saw with that estimate that was calculated by Bates et al. For people with eye, brain, and central nervous system cancer being almost $2,000 per patient per year. From this data, we saw that some of our participants spent 1.2 to 12 times that amount in 1 month on just either health service use, medication, or health-related travel alone. So hopefully there'll be more research into things like private versus public costs, as well as ability to pay. And these findings definitely support the growing call for more financial transparency in cancer care so that people can make informed decisions about, being able to spend these kinds of money. But yeah, thank you so much for listening to my presentation and the opportunity to present. If you want any more information, you can reach me there.